Sorry.
So, eeny, meeny, miny, moe. You're going to hold this, put that right on. There. Mike. And whatever you say will be held accountable in court of law.
Oh, good.
All right, ladies and gentlemen. All right, so no bad words. So, okay, so now, who is going to scrub in on your team? You. You on this side. Your partner in crime are here, and you're going to be this, and you're your partner in crime. So the objective for you guys as helping them out is my perspective of this scenario is if you're working in a room, we're both working together, right? Somewhat it's faster because I think you've been shown to do everything on your own, which is okay, and that happens. But now you have a person to assist, and you're going to get in there and start setting up. So the idea is to, whatever you want to designate to be opened, let that person know. You put your gown right onto that table or that mayo. You know, you can go over here and pretend that a little bit get wet and then get in there and scrub in. When I say scrubbing, get your gown and start setting that table. But before you do that, you have to establish your back table open, right? Verify with that person, hey, this is what I want opened by looking at a preference card. We don't have one today, but you will. And then once you establish that, I want to scrub in while you open. Boom, get in there. You're going to open stuff to the table. Does that make sense? When I say you, I mean the person that's with it. So I just want you to go through your normal motions to get that table, that tray set up and get ready for a count. And also, if you got drapes, right? You have the laparoscopic drape, you got the 3/4 sheet, you got the doctor's gown. Make sure you set that up in the order it's going to be used. That's where I want you guys to get to a finish. And then I'm going to come to each one of them, and I'll do a count with you. As long as you guys are good, I'm going to assess that. And when you're done, if we have time, we're going to turn this over and so the next person can do the same thing. If we don't have time, I will extend it on to the next class, but that team would be starting.
So, since she's like opening and I'm like the circulator, am I gonna be like tying her up and then am I opening stuff for her?
Did I say that?
Yeah, you said okay. I was just making sure.
No worries.
Because we didn't do that yet. Okay. What about meds?
What about men?
Meds.
Very good point. We're not doing that today. I'm omitting some things because for time, but eventually, trust me, there's a method to my madness. All this will come together to a point where your final evaluation. And in between this process, I'm going to stop and show you some specialty things. Not today, though. Today's just to ease into the pool, see where your skills are. If it's like, oh, wow, that's a hot mess. And I'm thinking it's going to lean on to loading up sutures and pass some things. That's typically where everyone falls. I'm not loading up the suture is a problem. But it's all about muscle memory now. We got 12 more weeks. We need to do these things where it's not, man, how does this load up again? It needs to be bop, boom, boom. Bop, bop, boom. Bop, bop, boom. All right, so as soon as I say ready to go, any questions? Last time for questions, and then when we're done, we're just going to go. And if you make a mistake and I say, hey, don't do this, just let me, I don't want to hear, well, Chrissy showed me this. This is the way I did this. I'm just giving you my opinion on the way I think you guys should do it this way. And I'm probably leaning on towards how you set your tray up and maybe how you do your towel rolls. I'm going to show you the way I would prefer you to do it. Yes?
I just have one quick question as the person who's scrubbing. So whenever we've opened in the past, Chrissy says our gown is the last thing to be opened. Are we opening our gown before they open the rest of the stuff? Or are they opening our gown for us?
So I know Chrissy's showing you. I've been trained, and it's a lot easier. It's all about quick and time.
Mm-hmm.
So if you're waiting to put your gown on that table and you're trying to both open up, to me it's a lot. It takes a lot longer to get that case set up than opposed to where as soon as you establish what needs to be open with your partner, if I'm working with you, I say, hey, what do you need open? This. Okay, I can read the preference card. You scrub it, and I'll open it up for you. Get your gown on there. Go to scrub. Get in there. Start setting up.
Okay.
I want to be standing here. Where would you like your stuff? And now you're going to say, you know what? I want stuff over here. Because if you don't, there's just 52 pickup on your back table. And also when you're setting stuff up on your back table, wherever it's going to live needs to be that's the place. Not here. Oh, it goes here. Oh, no, it's over here. You need to make sure it's a one-time movement. Preceptors hate movements. It's all about fomites and things being flown in the air and bacteria. Does that make sense? I know Chrissy's right in some aspects, but today my only thing I can teach you is how to work as a team. And I find that maybe there's a scenario where you're by yourself, you're doing a case by yourself, that'll apply. A DNC and some small case. Okay, you're going to open up all this stuff yourself, and that'd be the last thing you do because you don't want that thing hanging out, being exposed. In this case, you got a partner. That makes sense?
Yes.
One more question? Are we good? Let's see what you got.
So,
I'm just going to watch how you
All right,
respond.
partner. So I'll have you open the 3/4 drape, the lap drape, surgeon gloves, and the surgeon's gown.
After you already got your second grade one. You want it after the instruments are on your field already or after? Because you would need this and then you
So we need this open, and then you'd open that stuff while because I can't do the second drape until I'm scrubbed in anyway.
Okay. So you want me to open that onto this bare thing, right?
Mm-hmm.
Okay.
yeah. Is it okay if I
Now, it's just you all do great. I'm just going to point something out, and this whole process, I'm going to point stuff out. You can help her open that up,
Oh,
right?
okay.
You just stand there like, "Hey, you're doing a great
And
job."
we could do it simultaneously.
There you go. I would love, if I'm working with you, I would love for you to help me, not watch me. Perfect, and then just back way. Yeah. It's all about speed. Eventually, I want to see good turnover. And, you know, you're talking 20-minute turnovers and quickness, right? But also accurate. Now you're good to go. Got a good field.
Okay.
I probably wouldn't have your stuff here. You can lay it right on it. There you go. That's fine. Right behind you.
I'm like trying to remember what I have to do out of the pack and what I can just like take out.
Now, here's the deal. When you, I want this, and I know this is very picky for me, but when you're checking this, you're in that corner. This is how I would do it. No strike through, no holes. No strike through, no holes. Reason is that there's a nurse in that corner. Did you check that? Yes. Well, I didn't hear you. So make sure, just for that person alone, verbalize it as loud as you can. Yeah. This is your time to yell.
Okay.
See those. Okay. Yeah. So whatever you're opening, we're going to rewrap.
No strike through, no hole.
So whatever you're opening, we're going to rewrap. So remember that. Save these little things. Otherwise, I will get killed by Chrissy.
All right, I'm gonna scrub.
I don't want to get killed.
Lena. No.
You said to open this.
Yes, but you can't put this on here. You're not sterile. This isn't gonna be sterile, so you have to.
Open the pack? I gotta go grab. Or you want to like?
You have to do the whole thing. You can't put this onto the back table.
Yeah, that's.
Hey, you focus on your table, and I'll focus on them guys.
Mm-hmm.
So what happened?
Oh, she took it out and put it on here. So I was just explaining to her
Okay,
you have to
got
do
it.
the envelope opening.
All right.
Oh, you want me to do that? Okay.
Yes.
Oh, it moves with you, huh?
What's that?
It moves.
So let me show you.
Oh, that's scary.
Okay. So this is where you're going to have, right? So you're going to open up like a banana. One. Cover, and the whole idea is to cover your hands. You never want to go over, since it's open, you don't want to go over that. So you always want to stay where this is going to be like this, right? So the ask yourself, how do I get it to the field, right? Either if she was scrubbed in, she can grab it, but if not, you got to, right?
Oh yeah, I forgot about that.
Oh, yeah. Make sure you don't go over. Just grab it from the middle. Yeah, and pull it down. There you go. There you go.
Can I just place this somewhere if I don't have a circulator?
Well, you have your partner.
But she's in the middle of it.
We'll move the garbage can as close as you can, but yeah, when in doubt, just try to grab it, give it to someone. If not, just drop it to the floor. Do you guys have your own personal eyewear?
No.
Okay. Well, we'll get to that in a minute, but eventually we're going to have to wear eyewear, especially for your final evaluation. What did you guys, about muscle memory? Did Christy show you to wear eyewear all the time or no?
She told us yes, but we just had to tell her when we would put it
You
on.
pretend. I don't like pretending. You're fine.
Oh, do we get over?
You're fine. That's how it's going to be out there. You're going to have someone just staring at you. And you say, hey, is this right? They'll be like, you don't know how to open anything? And they'll be like, no, I don't. That's good. So the whole idea is you do perfectly is to stay 12 inches or 1 foot away, right? So I kind of just go into it, just kind of project it onto it. You're fine. Yeah, it's perfect. All right, patients coming in the room here. We got to get a count going.
Ow.
Heard. You need to come out of your shell. Start speaking and yelling at people. It's great. Response is what I want to hear, right? And that's what nurses are going to do. Are you ready for a count, Bree?
I'm going to get the second glove
There you
on.
go, right? Not just quiet. Yeah, exactly. Let them know what's transpiring, right?
And you want us to set up the Mayo stand and everything?
So I want you to do what you normally do. We'll do it that way.
Okay.
You want gloves that big? You want an 8? Yours are the 8, right?
Doctor's an 8.
No, the doctor was an 8. My gloves are 6.5 and on my hands.
So, keep your thought patterns to a minimum. Your objective is to open stuff, period. If you don't know what's in there, just let me know. You should have.
Well, I opened her gloves as well, right?
She has her gloves already. They're on.
Oh, this is for next.
We need an 8 glove for the doctor. Okay.
Oh, that's so. I'm gonna use an actual towel for.
So that's the towel I'm referring to. If you ever do vascular, it's fine now you end up, but that's something you could lay down for contrast.
Gotcha.
So I always just I use it all the time. No one doctors never use it, but
Okay.
when I did the 3 and 4s, I would lay that as a kind of a doily, so to speak, underneath and put all my because it's better contrast. So that's what I was referring
Gotcha.
to. Yeah.
Okay.
Where do you want me to get another towel?
Another towel for what?
No, I use the blue towels for the surgeon.
well,
Is what I was saying.
I was just saying I would never throw it away. I would just use it as kind of a contrast. Remember that I was showing you before,
Yeah.
because it's just wasteful. And most doctors want blue towels. They don't want the white towels. Give me that. That's just bothering you. As I stab myself.
No contamination, that's very good.
What did you check for a chemical indicator?
Yeah, it's right there. Do I have to say that out loud? There's a chemical indicator.
How do I know? It's right there. How do I know? I'm
Right.
a nurse. I've been doing this for 30 years. I don't believe you. Chemical indicator is good. Say it out loud. And you need to say no strike through, no holes.
No strikes, no holes.
And no
Chemical
condensation on the bottom.
indicator is good.
I'm just telling you. These are pitfalls.
Got it.
Because you just doing exactly what you just did to a nurse is like,
Right, they'd never let it fly.
what are you talking about? I've been doing this for so long. I don't believe you. Make sure you let everyone know.
Okay.
And so I'm just trying to tell you, it's not personal, right?
Mm-hmm.
It's just I'm trying to let you go with the grain. Yes, ma'am, no problem.
Gotcha.
Yes, sir. And that's just how I was trained.
Yeah, as long as you're not grabbing it.
Okay.
So yeah, flip it. Yeah. Okay, as soon as I get out of the way.
Did you spin by chance, Bree, or no?
That I spent?
Yeah.
No, she did.
I'm just trying to figure out why your ass is hanging out here.
Oh.
No worries. Is that an extra large gown? Yeah.
It is.
Okay. Let's do it.
Go ahead. Oh, you already did it.
Who feels nervous?
Me.
All right. Don't feel nervous. There is no wrong answer. I'm just wanting to see how you respond. And that's the key. A preceptor will let you know you're not doing something that he wants. But your instinct is all this that you know, put a tray up there, get things ready to go, get your sharps going. It's stuff that's universal everywhere and should be just second nature.
I don't think we needed to open a surgical gown because we already have one.
That's fine. No worries. You just need a gown for the doctor. So if you have one already open, let's just use that one, okay? And I want you to set up the drapes in the order you're going to use it, with the doctor's gown being on the very top. Does that make sense?
Oh, yes.
So let's think about it in reverse order. The first thing we're going to do, everyone listen to me, and I know you're going to say, well, we do it differently somewhere else. The first thing I want to happen when you drape a patient is a down sheet.
Mm-hmm.
Second thing I want you to happen is to square off the incisional site with 4 blue towels. Next thing after that is the laparotomy drape. So you're going to do it in the order of where we're going to drape it in the sense of how you organize it. The very top is going to be the assistant's or the doctor's gown. So set it up in that order, right? Make sense?
Yes. So we don't need that one because we already opened the surgeon's gown.
Start calling you Forrest Gump.
You said surgeon, drape, square off.
Here, 3 me, 1 you. I'm not trying to be inattentive.
No, do it.
I'm just trying to.
Tell me.
So when you get it like this, so instead of laying like this, just and just have it either nice and ready to go. So it's a little bit clean and organized, right?
You want us to set up our name?
No, don't. Just get to where you're ready. You tell me when you're ready for a count, and I'll
Oh,
tell
so
you.
you don't want to study in the Mayo stand up?
I mean, no instruments.
Okay.
You can't set the instruments up on your Mayo until you do a count. That would be Don't count. I said I want to count with you. Tell me when you're ready for a count, and I'll come to you. You're ready for a count. So everyone else, just wait until I come to you, okay? So I'm just looking at this. So I'm going to show you a way that I would want you to start doing this way. So this is beautiful. So this is suture, right? So it should be with your sharps box. So gather, when they say gather anything that's countable, this is where it's going to go. Not over here, right? Because we get lost. And you should get used to, if you have blades, needing to be open up, not in a package.
Okay.
But since we're probably not going to use them today, but when you start getting to where we get to the field, make sure we're opening things up. Because you can't just say, hey, 10 blades, because there could be 3 of them in here.
For last final, that's something I missed because when we would do it, I wouldn't open it up. So then in the final,
There you go.
I did.
Yeah. All this is muscle memory. You know, it's not something you've not
Are
heard
we
already.
supposed to be opening
And-
these and loading?
All right, so can I just show you
I don't
get an
have
extra
one.
blue towel? No. I'll use this, okay. So let me just show you.
They did not open.
And these are just recommendations. And I'm going to come to everyone, so just hold off. So I would rather you quickly set up just like this. I'm going to show you, okay? Now, if you want to do it the way Chrissy does it, that's fine. As long as you're organized when I do a count, I'm okay with it. But I'm going to tell you 90-some% of the time, this is the way they're going to do it out there here in Port Charlotte in Florida. They're going to quickly get a towel roll. And I'm going to show you the way I do a towel roll. So typically, you want to go where the size of the stringer is. So that's a pretty good size, right? So I like to double down on them. So it's nice and thick. Don't open it up. So you can use 2 of them. So that means if you needed extra blue towels, you're probably in your interest to get some extra ones, right? Mm-hmm. Never hurts. But I'm just going to show you the way I was taught. I would just go like this, like you're doing a little plane, and then just quickly tighten and roll. It's kind of like a burrito. Okay. Tight, tight, tight. And then just smooth it out, right? Smooth it out. Yeah. So, okay, good. Nice and firm, right? So then I quickly, before I said I'm ready for a count, I'll quickly just grab everything out of my tray, put my stringer down. Oops, someone screwed me here. I know, I see it. Let's see. Quickly get everything out of there without it being cluster. So what I used to do is, the objective now is let's get everything out of there as quickly and calm as you can. I want to show you.
All before you're doing the count.
Right. There's a method to my madness, trust me. Because I know you guys were showing the count and then put everything together. To me, that's just not the way I was showing. I quickly get everything out. Feel around, make sure everything's out of there. This is garbage. I just put in my little suture box, but I don't have one. Yeah, don't touch my feet. So then I quickly just traumatic to one side. Just quickly put my forceps on to non-traumatic. Got my knife handles. Countable. Traumatic. Traumatic. I know you guys do this. I just do it in reverse order, and I'll tell you in a minute why I do it. Make sure that's not hanging over the table. My sends, I normally just sit right there. Pull suction I leave out because I want to see it. All my Richardson Eastmans I leave out. My Army Navies sends I leave here so I can see them. My ribbons, I don't like putting them in there too much because they slide down, so I leave them off to the side. Okay. You leave it on the stringer. So now I'm ready for a count. I can go through everything, right? If I'm going through it, 1, 2, 3. I'm telling you, you do it this way, and you say you're ready for a count. Patient comes rolling in the room, you're ready to go. Opposed where you're counting like it's, and now you still got to set up and organize. I would prefer you to get to this point, leave the stringer on until you're done with the count, because you can use this as like a little guide. It's not falling anywhere. 1, 2, 3, 4, and slide them over a little bit. Right, and count that way. So let's do a count real quick, okay?
Traumatic on the
I'm not
right.
forcing you to do this.
No, I like that.
I would prefer you to do it this way because to me, I feel comfortable because this is the way I was trained. And I guarantee if you go to Shore Point or all these hospitals, it's the way they do it. Now, if you do OB, I think, in my opinion, they do it a little bit like Chrissy does it. Well, they just count right out of the tray. It's just, I don't. It's just the way you're trained. It really is. There's no judgmental on any which way. I'm also going to show you one thing here too. You don't want to have all your 10 rate texts here. Reason is, I don't know what the reason is, but the reason I would not do that is if you ever get a field doctor wants a rate tech, he's going to go like,
Oh my god.
grab all these and just. There's no way of you to control it. You see how they just tore on me like that? So if you did want to put up, always just put up in 2s. I can control 2. If they want more, well, give me 2 more. I'll give you back. It's your job to keep track of this crap, right? So when you do a count, I like to keep everything where it's going to be organized in a countable item. This is where the countable items are, right? And it even goes for, I know you're showing to put your stuff up here right away. That's fine. But this is where the countable items are. I can count everything here, not going over here, over there. And your Bobby also we'll get to in a minute. But do you see how this is hanging out and all flapping around? So I use too. So again, you don't have to. Let me just say I'm very anal attentive the way it is. So I'll go like this. Just tuck this in. Smooth it. And this takes 2. And if you don't know by now, I'm not a big person on towel rolls on your mayo, but so I normally just take 2. Quickly, just kind of get as close as you can to the edge, and just tuck them into the edges here, and then just smooth that down. And then you have a nice smooth surface. To me, it's a lot more protective. Now, when you do start setting up, you can start putting sutures here a little bit more organized. To me, it's like a smooth surface. You can do it that way or your way. Anything's acceptable. In my opinion, if stuff is here, it has a tendency to grab on yours and tear, but this is nice and secure. You just got to be aware about this side. That's why I try to get as close as I can to the edges.
Like you just showed, do you tuck them like that?
If I had a suture, I normally put my ties in here sometimes. Like if this was across the field, I would put my ties in here and maybe have a clamp or something down on it. So if you had to grab it, I can grab it or something like that. That's there for it. I didn't use it all the time that way, but I've seen some people on YouTube do it that way. Me, I'm not big. Do you see how that set up there is? That's how I do my trays a lot of the time, or my mayos. I don't have towel rolls. Now, if you want a towel roll up here, God bless you. Put a towel roll up here. Okay. So it's up to you. But again, when you're out there, preferences are for the preceptor. Let's do a count real quick. Let's start with Ratex, and you can.
Alright, are you starting with Ratex? Okay, Ratex or laps.
1, 2, 3, 4, 5.
Ratex.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Cottonoids.
0.
Needles.
1. Well, this comes in 2.
So when you're counting these, you need to make sure that we see these right. Clear that up. So, and it's a redundant system. I got 1. You can't just have that hiding, but yeah, 1. So make sure they can see it, right?
Blade.
Again, we know we open that, yeah.
1, 2.
You said
2.
Hypo.
1.
Bobby.
1.
We can't see it?
Yeah.
Why can't we see it? So what?
Put it in the count.
Well,
Now I feel like overwhelmed.
no. What I'm trying to refer to is, really, what are we counting here? The bovie or the tip?
The tip.
The Bobby itself.
No, just the tip. Because this comes off.
Oh.
So if you want to gather yourself, you can leave this here and gather into your sharps.
Okay.
And be like,
I don't know.
1 bovie tip. And then when you're getting going, put it back on.
Okay.
That's how I was trained. Because if you're doing laparoscopic and you're maybe I can control things in my box here, but that's what we're counting, not counting that. All right. Let's go from see what you know. This is your little test here. I want to start with the stringer. Go as fast as you can. Name the names, and then we'll go from there. Okay. So let's start with your stringer.
1, 2, 3, 4 non perf, 1, 2, 3, 4 non-perf, 1, 2, 3, 4 mosquito, 1, 2, 3, 4, 5, 6 Kelly, 1, 2 straight Kelly, 1, 2, 3, 4 Coker, 1, 2, 3, 4 Alice, 1, 2 Babcock, 1, 2 Console, 1, 2 Renningle, 1, 2, 3, 4 needle holder, 1, 2, 3, 4 scissors, 1, 2 sponge.
Forceps. Pickups.
1, 2, 3, 4, 5.
Tell me the names.
Pickle Friend Smith, Russian, Devaki, Rat Tooth, Hudson with teeth. Oh, this is the rat tooth.
They're both had some teeth. You're
Oh,
right.
two Hudsons with teeth.
Two right here.
Smooth tissue forceps.
Debate.
Devaki. Another Devaki.
Yep. Retractors.
1, 2 Army Navy, 1, 2 double Richards. Oh, 4 double Richards.
Okay. It's confusing. So when you do that, just say when you're counting 1, 2 Army Navy, 1, 2, 3, 4 Richardson Eastman. Don't do 4. Someone's going to say just do the count again because they get frustrated. So do it that way. And usually I just use that as a kind of pointer.
So 1, 2 Army Navy, 1, 2, 3, 4 double Richardson.
Okay, good. How many sections? Oh, anything else you want to count?
1, 2 pieces.
What about
of
these
wool.
down here?
And 1, 2, 3, 4 cents.
Okay, so these are sends and these are Volkmann retractors or rakes. So these are Volkmanns or rakes and these are send
1,
retractors.
2 rakes and 1, 2 cents.
Okay, good. And how many sections do we have?
1, 2.
So these are all sections. So these are counted as 2 pieces. So 1, 2, 3. That makes sense.
It's all just one category.
They're both suctions. This is a full suction and that is a yank out suction. But if they come in individual pieces, you got to count them as individual pieces. So 1, 2, 3. So yeah, 1, 2, and the 2 and the full suction, and 1 yank out, which makes 3. That's how they're going to do it. That makes sense. That's perfect. So you can quickly. Let me see here. Good. Where are the gloves for the doctors? So does this make sense that this has to go on the bottom, or does it go on this? So this is how it's going to go, right? So get used to open this up because if you had the gloves on here, it's just those little times like, okay, you get the gown, you're like, oh, where'd the gloves go? Get used to putting things in the order. Not to mention that CST exam will ask you of this order. What is the first thing that is going to be on the top? They'll give you a scenario of different people scrubbing in of the drapes. What is the first thing that's going to be on the top? It's going to be the doctor's or the assist gown, and then the gloves, 3/4, square off, and then
Would I
drape.
put their towel at the top?
You can, yeah, they won't say towel, but yeah, for the, obviously we stole your towel, but for drying purposes, you can put it right on top. Yeah. Okay, great. If you don't mind, just turn it over, you're fine. If we have time to do you, we can try to get to that point, okay? Yes, let me get over there. Oh, you already did it. Is that the way you do it all the time? Or were you just peeking over here? I'm just asking, it's okay.
No, I usually set it up after I count.
Gotcha. All right. So this is how's your towel roll? Pretty good. You like it? Outstanding. All
Yeah,
right.
wonderful.
All right. You like this? We'll come back to it. So let's do a count real quick. You have any Ratex or anything like that, or no?
Ratex?
So here's the deal. I don't like to have Ratex in tens up here. I normally just try to gather yourself with your sharps. Now, again, this is my preference and my experience of trauma. Try to make sure things are all in this. It's called gather your sharps, make pretty later. So everything that is a countable item needs to go here. Sutures, blades, laps, Ratex. If you grab your Bovie tip. It's a lot easier to count here than going to here, to here, to here, to here. So everything here, gather your sharps, count. Let's see, you had 15 sutures. Just have them all in this location. Don't have one up here. Your instinct is I want to quickly start setting up.
Right.
Let's get this count done, and you make pretty later. That makes sense? Let's do some Ratex. Go through this as quickly as we can.
You want me writing or just?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Laps.
1, 2, 3, 4, 5.
Okay, hypos.
1,
Blades. Nada?
0.
So we'll get some blades next time, but that's fine. Sutures?
1.
Okay, we'll make sure that we're opening these sutures right. When I say opening, is there anything in here? You got the smallest one. This is crazy. So you need to make sure that we can see it.
Okay.
And then, so this is weird because they've been known to have multiple ones in there. So you can't just say one. You got to make sure they see it and I see it, right? So
Would you load it before or after your count, or does it matter?
No, I would say you're not loading it until you count. My point is they
Okay.
need to visually see what's in the package.
Gotcha. Okay.
Because, like I said, it's been known to have multiple ones in there by accident. So, all right. So we had sutures. Bow we tip. Yeah, 1.
1.
Did blades. Hypo did that 1. All right. Let's go with the stringer real quick as fast as we can from your left to right and name the names.
1, 2, 3, 4 perf. 1, 2, 3, 4 non. 1, 2, 3, 4 mosquito. 1, 2, 3, 4, 5, 6 Kelly. 1, 2, 3 Alice. 4 Alice. 1. 1, 2 Babcock. 1, 2 Coker. 1. This is out of order. So this is a needle holder. 1, 2, 3, 4, 5 needle holders. 1, 2 right angle. 1, 2, 3, 4 scissor. 1, 2 sponge stick.
Forceps.
And you said you want the names. 1, 2 DeBakey. 1 Russian. 1, 2 Adson with teeth. Bickle Ferris Smith. 1, 2 rat tooth.
Okay. Retractors. I mean.
1, 2 Sens. 1, 2 Rake. 1, 2 Army Navy. 1, 2, 3, 4 double-ended Richardson. 1, 2 Malleable.
Okay. Suction.
1, 2 Pool.
Yank hour.
What?
Is there a yank hour?
Oh, yes.
So that means there's,
One
three,
yank
that means there's 3 pieces.
Okay.
One,
So you do 1, 2, 3.
Pool counts as 2 pieces.
Mhm.
Anything that comes apart in 15 pieces is 15 pieces. In this case, there's 2. Yank hour makes 3. And that's how they're going to write it, right? 3 suction pieces.
Okay.
And all right, anything you want to add to this count?
1, 2 knife handles.
Good. We didn't do your malleables, by the way. I just remember the top of my head. You failed. Go home. just fine. All right, you're good. You can break down. If we can get you going again, we'll go for you, okay? You're looking at everything I said.
Oh, Lena, can you put that back on for me?
Are you okay with this part, or like it's just setting up this way, and then doing a count? Like I guess most Chrissy classes they count out of here and then set up. I'm okay with whatever you do. I just say prefer. Let's do it. What we're gonna do. I'm gonna say I recommend that you do this because I think most hospitals want you to do it this way. Preceptors. When I say most people, preceptors like, what are you doing? So. But for me, I want you to feel comfortable, and let's just try it this way, okay? Boom, you go out there, good. Let's go through a count as fast as you can. Ratex.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10 retex.
Laps.
1, 2, 3, 4, 5.
Okay. Bowie.
1,
Sutures.
1,
Hypo.
1.
So you need to make sure we can see that, right? So I like to just have it out like that, so it's out, so it's under there. So the whole point of counting is so I see it and you see it. It's a redundant system. So if a nurse can't see, they're going to so gather your sharps, make sure they can visually see things. That's what they want to do. Okay. You got everything. Blades, no blades.
Yes.
Yes.
So let's go with the stringer as fast as you can. Okay.
I think, just throw that part.
1, 2, 3, 4 perf. 1, 2 non-perf. 1, 2, 3, 4, 5, 6. Kelly's. 1, 2. Adson. Or Alice. 1, 2 Babcock. 1, 2.
Right, he just wanted us to open it.
1, 2.
And I think he did make a comment about we were supposed to rewrap them or something.
Yes.
1, 2,
Wraps out
3,
there.
4
Okay.
needle holders. 1, 2, 3 scissors. 1, 2 sponge stick.
Forceps.
Do I need to like this?
Tell me.
1, 2 smooth Adson. 1 smooth tissue forceps.
These are at some brown. So 2 Addison Brown, 1, 2, 3, 4 steps. Yeah.
1, 2, Addison with teeth. 1, Bonnie. 1, Bigglesmith. 1,
Okay, retract.
I don't know if we know which one, which sizes which either.
These are rakes, or they're called Volkman rakes. Okay.
1, 2 rakes. 1, 2 Army Navy. 1, 2, 3, 4 double and then Richardsons. 1, 2 Bullet. 1 Malleable.
Anything you want to add to the count?
Yes. 2 knife handles.
Very good. Perfect. Let me see here. Okay. So I like to open these gloves out. Just get ready for it. Good. Now, I showed them over there a little bit about this. If you had another blue towel, I prefer to have it. So a lot of preceptors don't like the things hanging out like that. So I would just grab one blue towel here and try to tuck it in as best I can.
Anything blades.
And then I have the other one blue towel. You just kind of swing this a little bit.
What kind do you want?
Now you don't have to
grab
do it.
2
I'm just
random
telling you,
ones. I
most
don't care.
at least my evaluation too, most people out there don't like these hanging out like that. It just looks, to me, it looks unorganized. And I like smooth surfaces on the edges like that. I try nice and smooth. Again, you don't have to do it, but it's just the way I was trained, and eventually someone probably will correct you on that, and just want to let you know. Does that look better, or to me, I feel like, well, that looks clean and calm and surface. And so you can kind of set things here too, but I like to have a smooth surface. If you want to break down and get you going, we can go, okay? You did really good, Bree.
Cool. Stuff them in.
So does everyone remember how to wrap? It starts like this. Nah, you're supposed to laugh at that joke. So here, I'm going to show you how to wrap real quick.
That's beatboxing, isn't it?
So go grab some tape for me.
Tape?
Please and thank you. So we want to have the center part at a triangle, so that you kind of get it where it's in the center. So this part, obviously, you get just right at the level, so this little triangle is hanging out. Now this is the area you want to smooth out a little bit, because this is going to be folded in. So I normally just kind of, you can either tuck it, but since this is such a thin thing, you're just going to kind of tuck in like that, and then tuck the triangle that way. Then I just kind of hold it just like that. Put my fingers just like that and just kind of come in. And obviously this is where we're going to come with the flip inwards. And I flip this triangle back, because that's the area you're going to go left and right. This one's forward. And I just kind of tuck my hands just like that. And I go, it's not perfect, but I just tuck it in. And just for shits and giggles. It's like toilet paper, I can't find the line. Honey? I can't. I'm sorry.
She's not here right now, Brad.
Okay. So I like you guys. If you didn't open it up to the field drape wise, we're going to reuse them. If you already put it onto the field, we'll throw them away. But in the case of the ones that are 3/4 we didn't use, we're just going to reuse it for the next person. And if you are locked and loaded,
Well, that's
and
theirs.
what time is it?
Are we rewrapping the gown? We have.
Rewrap the gown if you can, please.
And this is yours.
So do you see how they have their pack all ready to go? We need to make sure we're getting there. So if you want to go, we got to get to that point. If you guys are ready to go, do you need a quick little breather to take a drink or anything like that? Or you want to rock and roll with Kim? Kim, you understand the job here? All right, let's do it. Do you have everything you want to open up for her? Gown-wise? 3/4, just kind of reestablish. Grab one suture, just so you can get everything in the order. If you want to get a 3/4 sheet again, you got this. Yeah, you want. So I just want to make sure you have a drape, 3/4. They can reuse that. That's fine. You want to have this gown draped up again or wrapped up?
Is that theirs?
Is it yours? Is that yours?
You gave me all this stuff.
Oh.
Yeah, this is hers.
Oh shit. Where's yours then? Oh, you have to wrap it up then.
I was like, I'm so. You don't want your towel in there, right?
No.
Do you want me to wrap it up for you? You need to learn how to wrap because it's going to be a hard process if you don't rewrap. You doing okay, dear?
I put something on your desk.
Is that money?
No, I did that when you guys were. I don't know if they have this now,
Oh, yeah.
Nope, that's
but I
wrapped.
figured this is a good way, you know.
Didn't we
Yeah, for
have
sure.
another?
I did, check in the back
I'm so confused.
when I was done.
The wrap for this, the 3/4 drape.
I just put it back. Because I had mine for I had the big one.
Last question is like match the insurance.
This one.
They are, right? Well, on the back, right?
Uh-huh.
Right? That's this exact photo.
Never loved you
Okay,
like
right?
I can.
And it says Rich Business Instructor. Is that not what these are?
You want to open with this?
Yeah.
I'm not okay. Hopefully I'm not forgetting.
You know, Richard's the Eastman are the large one, one small one. And,
Oh, let's put this.
A large and small.
yeah.
So I thought, like,
I'm thinking these are the Richard Eastman and these are the Army. It's hard to tell because it's
so when I,
but you know what they look like, right?
yeah, but what I just didn't understand about it was when I had looked back to see what I had right and wrong,
Is there a contradiction with that?
yeah, it said that,
One shot.
I don't even know where it is actually. It said they were called something like
Oh.
that.
Did Chrissy give you?
Barabel retractors. Barabel. I don't even know what that
I
is.
don't either. That's not a common name. I would have to look it up myself at this point. What I want to do is Chrissy has a whole pictures of slide flashcards with all the normal pictures that you should. I would study all of that.
I would love that.
Let me go see if she can get those for you. Okay?
But
Yeah.
it's just, you know,
Yeah, I know.
to show you that, like, I'm.
Why are you yelling?
So,
No, I know you're doing it.
no, I know.
I just feel like I
really
feel like
don't.
I'm neglecting you here, but
No,
I
not
think
at all.
I think it's better becoming on Tuesdays, and I'll probably get with Annika too, so I can at least give you guys the attention and not try to neglect someone that's actually paying for the class.
I think so.
Honestly, whatever day, I don't care.
Yeah. Yeah, we're getting. I'm just doing an assessment with them, and then one more time when we're done today. So if you want to stay,
Yeah, no, I don't.
stay. You're not obligated to stay because we're not going to do more than just basic stuff, opening stuff to the field.
Okay.
And I'm just trying to get through them so I can see.
Mhm.
And if you want to come in Tuesday, I'll give you a good 2 hours, and,
Okay.
and I'll put you through the whole ring.
What time do I come Tuesday? 8:30 or noon?
There's someone in here in the morning, so if you want to get here about, let's say, 1 o'clock.
Okay.
Do
One
here.
o'clock on Tuesday.
Let's say at about 1:30, 2 o'clock, as too much as you can. And then I'll tell that to Annika too.
Oh.
I'll text her instead of her coming in on Friday. So,
And that could work because by the time that we get done with that, then I can go.
and you're more, you could still come in on Friday. Just realize, it's not obligated. I think right now is for you to work on and get you so you're comfortable to get out there.
I may, as long as it's okay, I may come in on a couple Fridays because, like, I do want to redo like that what they're doing. Like closing up the shop pretty much.
Yeah.
The drop shop.
Yeah.
You know.
I don't mind you doing that at all. Just today I wanted to assess them, and then eventually, what you can do you remember how to make your own pack? I'm trying to think of what day Chrissy's doing that. Maybe you want to come in with Chrissy and make your own pack again.
That would be awesome.
So then you have your own pack, and then that's not my forte. Chrissy probably, let's go down and talk with her right now. That's what I'm doing.
And I'm assuming that we pretend that that's open or closed.
All right, so go to Chrissy. I have to watch them. Go to Chrissy and say if it's possible that she's in her office, just possible that you come in and build
don't
a
think that's
pack
ours. I think that
for
might be
me on
theirs.
Tuesday. Yeah.
I'll be here, remember?
You want me to start opening now?
The tape is too black. Ma'am?
Oh no! So I would get new gloves for you. Ugh. Okay.
I'm right here.
Do not pretend.
So I should have actually gotten her new gloves then?
Yeah, why not?
Okay.
I'm just saying, the whole idea is to get you a muscle memory. Can I tell you a story about that? Someone was out there and dropped something to the floor and picked it up, put it on the back table because they brain farted. And the whole time they were there, they thought this person didn't know shit, even though it was a mistake. And that's because they probably just pretended in the lab.
Right.
And that's not gonna be you, but I'd rather you listen. We'll buy more damn gloves. I'd rather you just go get some gloves, save that one later, and just grab another one like you would do in the real world. And
Okay.
here's Murphy's Law. Have it in here, and because just assume you're going to drop it, right? Or,
Okay.
Circulator. I have to do this too.
we'll just keep moving. Yeah, there's something called a sleeve.
Would I get her more gloves at this point too?
I'm going to show you where you're going to get her. Come with me.
Okay.
Keep going there, Lena. I know it seems annoying that I'm giving all kinds of stuff, but this is how the real world is. And it's like, this is called the sleeve of shame. So when she gets there, you're going to open up sterile, she's going to grab it, she's going to put it on like a sleeve, and it's going to cover that area.
Okay.
And instead of trying, if you like tore your arm or something like that, you can get that instead of regowning, okay?
Oh.
Open that up to her.
Well, that's cool. Chrissy would just tape us up.
You know, that's why I ordered all those. It's like, it's called the sleeve of shame.
So
I wore it a lot.
We have to shame you. We should put this on.
Open up. The wrap wasn't saved,
Sure.
so we have to.
No, no. So just put that on the hand that you pour your glove on. It's just the sleeve that goes over your arm. Oh, yep. There you go. Beautiful. And now you can keep working. And everyone knows you contaminated yourself.
Would you double glove over that?
Yeah. In the real world, we would double glove, but now you're going to probably throw it back in my face saying, well, we need to practice it. Well, I wish we had a lot of gloves, but we don't.
Mm-hmm.
You can do that? All right, good.
I'll be here on Tuesday. She said she has ones.
You're welcome to come on in here if you want to check it out. We're not doing meds right now. We're just trying to assess them.
You wanted 2 towels on the nightstand?
Yeah.
I put your cap on your thingy, by the way. She gave me one. Oh, thank you very much for letting me use them. I appreciate it. This is like what you were talking about in the reference, right?
That's called a purse string kind of thing. It's a drawstring, exactly.
It definitely seems a lot easier to be moving around in here and doing mock OR when there's not a giant wall.
Hey, Lena, I'm going to show you something. When I said the 2, this is the way I was referring to. You're doing fine. I'm just, again, these are all just recommendations. Do you see this? So I would go like this and just tuck it into the ends. And then kind of give a little spin. And I want you to do it the same way, the other way.
I check the next one. I can though. Next time.
Like this. And you tell me, you can do this way or not? You think this is better?
This is good.
I would prefer this by myself, but nice and smooth, looks clean and organized. No, nothing hanging out the sides.
I'll take that over and I'll put it
When you do your mayo stand, since you don't use the roll, do you have them all just side by side, or do you stack like ones on top of each
I
other?
go by 2, so if I have
Okay.
hemostats, kind of like that, I go back and forth.
Okay.
You can do a towel roll. There is no exact way to do it.
Well, I think I kind of like that because the towel roll falls.
But what you are going to do is the preceptor's way.
Right.
When you're hired and you're out in the world, you do your way.
Mm-hmm.
But when you're doing a preceptor, he says, I want a towel roll, I do a towel roll.
Okay.
Right? Or you're working with Brad, hey, I read you do this way. Oh, no problem, Brad, you idiot, I'll do it this way. But yeah, that's the rule of thumb.
Okay.
Right? Yeah.
You look at the technique of the second one, because we were showing some different ways, but I don't want anything to be like contaminated. I was told to do like this and then lay it down, right? Is that true or?
That is, everything's true. That's true, yeah.
Because
Because we were shown so many techniques that I don't want.
Yeah. So here's the kind of rule of thumb, and it's to help you feel comfortable. There is no wrong way as long as you're not breaking contamination. So the only way you would break contamination is if you would go below your field.
Okay.
So if you went like this down your hand like that, that's contaminated, right?
Okay.
So if you're going to go out, right, you need to make sure you just drop it and let it fall, and that's it. Now, here's the thing. I was always taught, see how it's hanging like that a little bit?
Yeah.
So I probably would just have that out temporarily until you're ready to go. And then just, where do you guys, I would go, yeah. Yeah, so you know inside, I would just hold it and just go out that way and then go out that way. Here, I'll show you how I do it.
You don't.
I would just hold it. So I just take it, let it fall a little bit. Since this is really small, it's supposed to be a little bit bigger. It's fine. Right. So I'm holding it so it doesn't move, right? The whole idea is not to let... Now, can you move this? Yeah. I would go like this. Because you know how I am. As long as I'm not going down below my field. Right?
Yeah.
So that's the key. Does that make sense at all?
I have a question
Yeah.
for you with that.
Okay.
So when you pulled it down, you kind of came down with your hand. Is that okay, or
well-
should it kind of come out? And...
Obviously not. So if I did that, someone
Okay.
would call me out on it.
Okay.
Okay.
Gotcha.
So the whole idea is
Okay.
I'm human too. And if I make mistakes, then no one can be perfect in the OR.
Right.
The idea is if you saw something and say, Brad, I think your hand went down below, I would say, okay, I'll get my glove off.
But like a good rule of thumb is like this is what's sterile, nothing below that.
That's a good rule of thumb to go with. Is it exact science? Are you going to call that every minute of the day? That's up to you. Because I guarantee you, if you sit in an OR, I can find 5 things throughout the time. Well, that was not kosher.
I never was either.
All right, so you
Gotcha.
choose your battles, okay?
I think the other
Okay.
fear is like because we are the ones that hold these, so we know that it's
Yeah.
gonna open up in a sterile fashion.
Yeah, just use that as a rule of thumb. Be comfortable where you were trained with Chrissy. I'm not trying to change that on you, so it confuses you, okay?
Yeah, well, I'm talking about like clinicals. Is it going to be folded similar to how we have it?
They could be different. To me, it's a little bit bigger to this end, and because I feel like it just stopped short here. So I think because we started it too far this way, that's why you have too much here and not enough here. So the idea is it gets centered in the center, so we have even on both sides.
Yeah, I think that might have been like what we
Yeah, not a big deal. And if anyone ever calls you out on something like you did, I'm not going to take offense to it. Because I can't watch myself 100% of the time.
Right. No strike through, no holes.
Yeah. And
I just as an indicator. I know. I'm not a.
Chemical indicator good.
no strike through, no holes. Yes, ma'am. Don't get shy on me now.
Oh, what?
That's not good in the OR. What happened? Oh, no.
What is this?
Someone just died.
So one of them is going to be your Mayo stand, and one of them is the 3/4.
No, this.
That's your 3/4 drape.
Oh, you're talking about for the patient, okay.
Yes.
Oh, so I just left it in there from last time.
No, I opened it already.
Y'all scared.
Are you ready for a count? Okay.
I'm in the middle of something.
Patient's dying. We need to get in here.
Turn around and be like, I'm busy. Like, big. You want it done right?
You forget something there, Kim?
I'm running out of towels.
Do you need more towels?
Yeah.
Can you ask your partner? If there's blue towels in that thing, you just have to wrap them up. Grab 4, wrap up. We need to get used to wrapping here at this point. So they got a lot of blue wraps here. Just temporarily wrap them like you're supposed to. If you don't know how, I can show you. There's tape on here. And usually they come in 4s, right?
Yeah, right.
Beautiful.
So
So try to have it. I mean, do you see this, Kim, on this side? So that's all hanging in there. So when you do that, just try to get all this tucked in. I'm not sure.
No, I didn't know.
Tuck it in like that.
Sometimes, I mean, you would never actually.
Do you think I'm like Brad, you're trying to be too perfect on it, or just the way I am?
No, I thought I could just like put it like
It's fine. All this, I mean, you're fine. You can touch down in here. That's fine.
And then we would all just sit down on the floor and fold the things, and she'd come by and watch it and be like,
Can you show me how to do your towel thing real quick?
Tell me when she's ready for a count over there. You want me to tell her? Okay.
Yeah.
So we get another one. So I usually have. You have another. Where's my blue towels? Let me just grab one. Oh, thank you. That's nice. Let's get that. So we're gonna. So just double it up. So then I look how big this is gonna go. So that's a good rule of thumb how big you want this. If it's a small work stringer, you can just do it this way, or a small. In this case, that's pretty decent size, right? So just kind of go up. You want it this end, not this end.
Oh, okay.
So just kind of, I double them up because I like it a little bit thicker on the towel rolls. So just go like this. Right. Okay. And then just at this point, just quickly tighten and roll as you're going. But as you're rolling, you're quickly kind of tightening it a little bit. And then just keep doing it.
Yeah, I was trying to do it. I don't know why I folded one side.
Yeah, it's all right. The whole idea for me is if this is not firm all the way through, it just seems to fall over the place and drives me nuts. So.
Yes. I think one of the needle holders is not with the rest, and then there's like, it goes Babcock, Coker, Babcock, Coker.
Is that a song? Babcock, Coker? Babcock, Coker?
You had your debate piece on the left.
Mm-hmm. I don't think it matters which side as long as your traumatics and atraumatics are together.
That's how I was trained. I have some people who say they don't like to do it that way. So. You ready for a count? You want to do a count with her, please? Start with the Ratex or laps, whatever you want to do there. You ready for your count, you said? Is your tray set up? Are you going to count like you did with... Can I just...
actually, I'm going to come on the other side of the window.
I'm thinking like to count the laps first.
No, we want to make sure everything's set up and ready to go before we count. So get the stringer out. I'm just telling you, it's better that way. Trust me. You gotta trust me, guys.
No, I'm on your way. I just want to get
So I usually just quickly get everything out of that tray and lay it off to the side. So don't. It's all about kind of going quick and getting ready for that count. Yeah, that's fine. Put those right in there.
long accent tooth, so there's 3.
Are you ready for a count?
Small rat tooth.
This is not an absent. That's a rat tooth.
Yes. Small rat tooth. Yes.
You ready for a count? All right. Let's go with, can you do a count with her with the watch? Let's start with the soft count first.
Laps.
1, 2, 3, 4, 5.
Ratex.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Cottonoids.
0,
Needles.
0,
Blades.
0,
Hypos.
1,
Bovie.
2.
I never got you sutures.
1.
Want to do the stringer as fast as you can from left to right?
Fast 1. Really? You actually want fast?
So here's the deal. I love you to death. Just when someone asks you something, yeah, we're not asking. We don't need a response. I need to count it as quick as you can, okay? Please and thank you.
2, 3, 4 perforating. 1, 2, 3, 4 non-perforating. 1, 2, 3, 4 mosquitoes. 1, 2, 3. 1, 2, 3, 4, 5, 6 Kellys. 1, 2, 3, 4 Alice. 1,
Babcock, 1 Coker, 1 Babcock.
How many
1
Babcocks do we have?
2.
Okay, 1, 2.
1, 2 Babcock, 1, 2 Coker, 1, 2, 3 Coker, 1, 2 right angle, 1, 2, 3, 4 needle holders, 1, 2, 3, 4 scissors, 1, 2.
Name the scissors for me.
Yeah.
Name the scissors for me.
Metzenbaum scissors, straight suturing scissors, and Mayo scissors.
Okay.
And then ring forceps or sponge sticks.
Forceps.
DeBakey forceps, rat tooth forceps, Russian forceps, add some with teeth, rat tooth forceps, Baker Ferris Smith.
Retractors.
1, 2 Ragnell, 1, 2 Rake, 1, 2 Army Navy, 1, 2, 3, 4 double-ended Richardson. So 1, 2 malleable.
Suction.
1, 2 pool. 1 Yankauer.
What are these again?
Sens.
Okay. And they have a Ragnell on the end. Technically it was correct, but just want to make sure. Yep. Anything you want to add to the count? That you do. Any corrections you want to make? Doctor?
Your knife handles.
Knife handle. Yeah.
1, 2 knife handles.
Outstanding. Count complete. All right. Outstanding. Good. All right. Now let me just tell you that this is. I'm not trying to dictate, but I would prefer you to kind of set this up this way. And you did fine. Leave the stringer on. And so when we get to this point, and the count is complete, then I'll probably in the real world say, all right, you can set your mayo up now. Does that make sense?
Mm-hmm.
Any questions you have at all? Yeah. All right, good job. Just leave the shame. Love it.
Oh, you don't have any? Typos?
I don't know, but I got 1, 2, 3.
You got 3 hypos.
Kobe?
Ciao. I'll see you Tuesday at what time? All right, Tuesday. All right, when are you coming in to do your pack?
Tuesday.
Okay, you're going to come in earlier and do it with her, or?
She told me to come in at like 1-ish, 2-ish.
Oh, and then she'll help with it? Okay.
Yeah, I'll text you.
All
I'll
right.
let you know.
Okay. Yeah.
1, 2, 3, 4. First call count. 1, 2, 3, 4.
Do I know what?
1, 2, 3, 4.
Where's your Kobe? Right behind you.
1, 2, console. 1, 2, right angle. 1, 2, 3, 4. Medium needle holder. 1, 2, 3, 4. 1, 2, 3, 4. Medium needle holder. 1, 2, 3, 4. Scissors. 1, 2, sponge tip.
Forceps.
Forceps. You want me to do which ones? The knot?
Just name them all for me.
Okay, so I have a rat tooth, 2 absins with teeth, and then is this a rat tooth as well?
I don't know. Tell me. What do you think? It is a red tooth.
Yeah, I would say it looks like a rat tooth.
So they're just different grips. That's what confuses people. But basically,
Bonnie.
no, Bonnie's a little thicker, but they're both have the longer extension. So this is for more fascia opposed to where this is more subcutaneous. 2 rat tooths, 2 absent with teeth, right?
Yeah. And then I have a Russian, 1 Nickel Smith, 1, 2, 3.
Outstanding retractors.
Should I have 2 of them in there or leave 1 out? I have 1, 2, 3.
So I put 1 in for your surgeon's gown, and then this one's not folded. We can try wrapping this one back up.
3 suction. I have 1, 2 knife handles. 1
Count complete. Good job. Do you feel comfortable with this process? Because this is with a staple I'm going to use from here on out. Okay.
Yeah.
All right, good. You want to help her just turn over, and then we can just clean up, and we'll
Oh
make.
yeah, I forgot these.
Let's see.
1, 2. I don't want to know grade off. 1, 2.
So I'm so anxious to quit.
1, 2, right.
It's Friday. Let's hurry up, guys.
Alright.
All right, cool. So I just realized when I do it in the future, I'll have a sheet out, and we're going to follow that sheet to the T from start to finish all the time. But now I know that you know the names. I'll probably just do the total amount, so, like we normally do.
You still wanted us to wrap these up, right?
Yeah, of course.
Okay.
You're gonna be one of those people, aren't you?
We're ready again.
What?
Let's wrap it up, man.
We're ready.
Oh, I'm sorry. Yeah.
This one was.
How is Coral? Let me see here. Do you feel comfortable? Looking good? How's she doing? I watched you. Well, if I didn't see you, I see you on camera. You ready for a count? Bratex?
1, 2, 3, 4,
No.
5, 6,
This is not good. Yeah.
8, 9. There we go.
Good enough.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Right there.
You get 9. So what happens when we have 9? The world ends. So what happens to the patients in the room? Where are these going? So the answer is these would come off your field and go with the chart, and you would open up a new one. So if the patient's not in the room, we just get rid of it out of the room. But if that patient's in the room, it needs to go with the chart, and we just open up another 10 pack. In this case, let's just continue. Laps.
1, 2, 3.
Oh, you need a mail stand cover.
Okay. Blades.
No mail share.
Oh, it
Hypos?
is been.
Bowie. Sutures.
1, 2.
Outstanding. Okay. We're going to go with the stringer. Let's count
When was
these
that there?
this way as fast as you can,
Yeah.
knowing the names, the correct
That's
name.
mine.
Perforated,
Yeah.
polyp 1.
Wait, there's one right here.
3, 4, non-perforated 1, 2.
Yeah, this is yours.
1, 2, 3, 4, 5, 6. Kelly. 1, 2.
It's okay. Keep it. We got this one.
1,
And then we don't actually need this since we, yeah.
1, 2 right angles. 1, 2.
I was saying, did anybody see that?
4 needle holders. 1, 2, 3 scissors.
Name
No,
of
it
the
almost went in the floor.
Again?
What are the name of the scissors?
Mosquito.
Okay. All right. What else? They're medicine
Say
ball.
medicine bomb and then suture.
So two medicine balm and a suture scissors, right?
Okay. 2 medicine bomb suture scissors.
Okay, and all right, continue.
Ring forceps 1, 2.
Pickups or forceps? Names of them?
Okay.
Please and thank you.
1 Russian. 1 Bonnie. 1 Bickle Ferris Smith. 1 accent with T. 2 accent with T. Smooth tissue forceps.
Outstanding.
1 brown accent 1. And brown accent 2.
Okay, retractors is finished strong.
Okay. 1, 2 Army Navy. 1, 2 rakes. 1, 2 goalettes. 1, 2, 3, 4 double-ended Richardson. 1 malleable.
Anything you want to add to the count? Knife handles?
Yes, I have 1, 2 knife handles.
Did we do suction at all? No, there is no suction. Got one yank out, right?
Yes.
Good job, guys.
Do you do the fold on yours?
I think all of you are
Is it so
outstanding.
small?
Chrissy is such a great teacher. Well, my job is just to make you flustered. So, I think now my it's just by the time you get to the final evaluation, all this stuff's going to be second nature. Is when you go out there or there's some variables there, you just need to roll with it and pivot and just be
So
professional
yeah.
and try to limit your conversations about like, wow, that's not the way I was shown, all those pitfalls.
Okay.
Because I don't mind you doing it to me because I don't really care. I understand where you guys are coming from. But I just want to realize, just be open-minded to learn because I've taken multiple ways and made it my own. eventually you're going to have a better way, and I'm open to learn from you, and that's the great way to approach it.
Which
'Cause
one?
If I think I knew it all, that I would advise you to run the other
I
way.
was trying to check. I'm a dental assistant. Right?
Yeah.
And there's this other lady.
And I was thinking about, he gave me the mic, and I was like, I was probably the wrong person to give the mic to, because it's just going to be me singing the whole time.
So I was training someone and she walked in. She's like, "This looks awful. This isn't how you do it."
Okay, can I help you guys?
To me, that's just an ignorant.
Embarrassing.
What's an ignorant way to think?
Well, you guys are.
You might have a way that works for you, but if your way is better, why wouldn't I have a big enough person to say, you know what, Bree, I love your idea. It's my idea now. It's not a big deal, right? If your way is great, why would I not want to do it your way?
They can choose my battle zone.
Yeah, I hear you. But that's my point when you're at externships. See this little lip? You gotta bite it.
Oh,
You gotta do it, okay? And then come here, we'll complain together, okay? Because if you do, not that word again. I learned that last class. I was so ignorant. All the kids were saying bet. I was like, what are you betting? I was like, and so it's equivalent to like, I guess saying word or something.
yeah.
So I was like, all right. So that's how old I am. Word.
That's
So
kind of
bet.
like heard, like, you know, when you
Well,
said-
heard's common, but bet, that's something. That's,
Before you said that, I've like.
Kim, do you just fold this like corner to corner? Oh, okay.
I don't do the whole.
The fancy.
I think that's a military
Yeah,
thing.
but mine never came that way.
And kitchen. Yeah, right. Kitchen. Heard. You're absolutely right, yeah. I
Your
should
ring
know
force
that.
up?
Okay, when you guys are all cleaned up and ready to go, we'll just meet here and we'll get on out of here, okay? Enjoy your weekend. And I'll tell Chrissy, like I said, every class, you guys are spot on. There's really, you guys, there's only variables I can show you. And now we're going to work on just some specialty things. And your final project of the video, choose a case that you guys are interested in, but also keep in mind, we're very limited to what we have here. Last class did
sorry.
on open heart surgery. We don't have open heart stuff. So choose something that you guys can have fun with, but maybe make sure we have the supplies for it.
I know you guys have a lot of urology stuff.
Urology, maybe some general stuff. Open heart? It's kind of hard to do. They did it though. But it was pretty.
Why would you do that?